Doctors and nurses, what disease should scare the crap out of us that we currently don't take seriously? I feel like people don't take diabetes as seriously as they should. It's something that could cause you to lose one or multiple limbs, your eyesight, or even your life. Also, tooth decay. I've seen quite a lot of people in their 30s who neglected their teeth during their teenage years and young adulthood, and required extensive dental work, which isn't only super expensive, but also very stressful for the patient. Brushing your teeth twice a day is a very easy way of preventing that. Heart disease. I work in a cardiac ward of a hospital. 40% of our patients are just really old, 85 plus. 50% are people between the ages of 40 and 60 who are obese or very overweight. Old people have heart problems because they are old. 40 to 60-year-olds only have heart problems because they are obese and lead unhealthy lifestyles. I would say almost all of these patients could have avoided their heart problems by watching their weight and walking for 30 minutes a day. For those who were wondering, the other 10% are legitimate, unavoidable stuff like 10-year-olds with holes in their hearts or younger people having a pacemaker replaced. Lou Gehrig's disease. It essentially shuts down your muscles and important organ systems over the course of 5 or so years. In the end, you have a functioning mind, but you're trapped in a useless body. Many athletes and military veterans get diagnosed with it later in life, and we don't really know what causes it or how to prevent it. What's even more concerning is the fact that many more young people are being diagnosed and having their lives cut short. I remember seeing my first Lou Gehrig's patient during my infectious disease rotation. It will take over your entire body but spare your brain. In the older days, people would die of respiratory failure, but now they can keep you alive on machines and feeding tubes. So you have a person with a perfectly normal brain, who is able to understand, compute, and think in a body that's not responding, and they aren't ready to die because they know their mind is perfectly active. Yet they rely on someone for every aspect of their life. I can't imagine being in that position, choosing to die while being completely aware of your surroundings. Doctor here. Here's the truth, and I won't go with the sexy or the high-profile answers. But I will tell you on the whole, that for everyone reading this right now, the vast majority will not get the crap scared out of them from high blood pressure, high cholesterol, and diabetes. But you should. Hello, not a doctor here, but a medical student studying for the board exam. The solution to the problem is a bit complex. There are many factors which come into play here, and I will try to list just a few since running around at the moment. Overprescription of antibiotics, probably the single most accelerative factor of this problem. Prescription antibiotics are off the charts. The bacteria have certain skills, and the more unnecessary antibiotics we take, the more practice we give the bacteria to come up with a way to avoid the drug. And it's not necessarily the doctor's fault in this. We as a generation today prioritize convenience over hardship, so the fever, which was actually supposed to be good for us, we medicinally force it down. We don't give our bodies the time to fight back, which it is perfectly able to. Not all bacteria is bad. Everyone has heard of good bacteria which help us. Some of the most resistant superbacteria around today are thought to be developed primarily due to the fact that antibiotics killed our good bacteria, which was keeping the superbacteria in check. But now it can't. Health and sedentary lifestyle, everyone knows this one. Exercise and good food intake. The better it is, the better you can fight off any infection, including viruses. The intricate workings of how we fight off infections are ridiculously beautiful and effective. Exercise basically pokes the immune system, and your body goes like, what the hell was that? You sweat out, increase elimination of toxins and byproducts. You increase circulation in the body, which allows your immune cells to make round trips around your body faster. This increases the chance of finding a foreign intruder. In regards to food, without going into technicalities, processed food, sodas, and chips are not nutritious, take a hell of a time to digest, and honestly the stuff in them sometimes, who knows? Stick to regular, preferably organic food. So eat well, exercise, and always ask your doctor about the necessity of an antibiotic, and if you can do without. You would be surprised how many doctors just prescribe it so that you don't complain about a day's worth of annoyance. May the odds be in your favor. Here's something that is not a disease, but that I think you should really care about: diminishing long-term treatment compliance. What is that, you ask? Well, say you're on a treatment for a certain disease for life. At first, you take your pills just like your doctor prescribed. Then, months in, you slip a few doses, or maybe some days you don't take them at the precise schedule they should be taken. Then you skip days altogether. And why do you? Because you stop feeling sick, or you stop noticing the difference the medication does. This can be catastrophic in many situations, but there are two that I personally consider more important: in mental health conditions, and in immunosuppressive therapy after an organ transplant. In both these cases, you stop noticing what the medication is actually doing, and as you stop being disciplined about it, you increase the risk of serious complications and acutizations. Non-compliance in immunosuppressive therapy in particular is very bad. These days, even delivering different numbers, every published study agrees most rejections are caused by non-compliance to treatment. You're about 3 times more likely to develop a late acute rejection if you're non-compliant. Basically, your lack of discipline can cost you your very rare second chance, your kidney, your liver, your heart, lungs. Same goes for diabetics. You don't notice your glucose levels are through the roof as easily as you notice they're too low. You skip a few insulin doses and notice no immediate consequence. That doesn't mean they don't exist. So, just remind yourself that the medication you buy and take every day is there for a reason. You feel great, probably because it's doing its job. I see you are weighing in here. Disease to fear, infective endocarditis. You get a bloodstream infection as a result of anything from a puncture to a rotten tooth, and these bacteria start forming these little vegetative leaflets on the backsides of your heart valves. They grow bigger and bigger and bigger until one day one breaks off and your cardiovascular system takes it away to become lodged somewhere. If it's small enough and you're really lucky, it will get stuck in your lungs and you'll just have a pulmonary embolism, or get stuck in your kidney. But you probably aren't that lucky, so it will lodge itself in the brain or go straight to your heart and you're dead before you can clutch your chest. Here's the really awful fricked up part. If I see you go down and hit the floor from this, I'm going to immediately start CPR. I'm going to start compressing your chest like it's my job, squeezing your heart and pumping blood. But when I do this, more of these leaflets are going to start breaking off and showering your organs with these little emboli that will get stuck in those tissues, causing further damage. If you're lucky, you'll stay dead. If you're not, you'll have a short, meaningless, tortured existence. Nurse here. Clostridium difficile. This is a bacteria that infects your gut. It causes explosive diarrhea and kills 14,000 Americans each year. The bacteria can't be killed with normal sanitation solutions because it will turn into a spore, which makes it last months at a time on surfaces. Hand sanitizer doesn't kill it, you have to wash your hands. Our normal cleaning wipes don't kill it, you have to use bleach. I take care of C. diff patients all the time, at least one a week. It's super common in hospitals and it is resistant to most antibiotics. Not a nurse or a doctor, but still kind of, relevant. Take your body seriously. In college, my roommate got flesh-eating disease. We believe she got it from tanning in a tanning bed that was not properly disinfected, but there's no way to be sure. Its clinical name was necrotizing fasciitis. One day she felt like she had pulled a muscle. Later in that day, her leg got red and eventually got a bit swollen. She complained of pain for 2 days and we all just contributed that to her being a drama queen and wanting attention. Her mom, being a nurse, advised her to go to the hospital. They rushed her in for surgery to remove the rotten skin to avoid the infection spreading, though it did continue to spread. The doctor told her that if she waited another day, she would have lost her leg, and any longer than that and she could have died. Over the 17 days she spent in the hospital, she had 7 surgeries and 2 skin grafts. Her leg was done for. I had tuberculosis a couple of years ago. I'm in the US. When I started feeling symptoms, I thought it was just a cold. I was coughing a lot and had severe night sweats. After a week of waiting, I was getting more impatient than worried. So I waited another week with mounting symptoms. The few days before I went to the hospital, climbing the stairs to my second-floor apartment would take all my breath away. I couldn't believe how difficult my breathing became. I went to the doctor about 2-3 weeks after symptoms first started. They x-rayed my chest and found my entire right lung was surrounded by fluid, rendering it useless. My left lung had some fluid around it, but I was still getting about half capacity out of it. Super long story short, I spent an extremely miserable week in the hospital, quarantined in a special room. I had a pleurocentesis done to remove 5 liters of fluid from around my lungs. Then had a more rigorous procedure done to drain some of the fluid that had solidified near the bottom of my lungs, and had a chest tube inserted. That tube ran from my right lung cavity, through my ribs, to a bucket thing collecting my fluids. To move around, I had to carry my fluid bucket with me, careful not to pull the tube out. I lost about 35 pounds in that single week. The incisions became infected with topical TB, and are only just now fully closing. It's been about 2 years since being in the hospital. I'm breathing at about 90% original capacity, and I wouldn't wish TB on my worst enemy. Honestly, the biggest health risk I'm seeing more and more in young populations is obesity. Obese patients that come in with relatively benign problems fare much more poorer than people who have an appropriate weight. I'm in the intensive care unit this week and there are 2 patients here who are obese that came in with relatively treatable illnesses, except their bodies behave as if they are in their 90 seconds. Additionally, there are an increasingly more and more peer-reviewed articles stating that obese people do much worse in major surgeries and difficult hospital stays than any other population. Lastly, the generation right now that are obese and sick are usually in their 60 seconds, and didn't turn this way until their late 40 seconds. However, nowadays you are seeing more and more children become obese at a younger age, which can lead to more devastating illnesses at a younger age. All the patients I speak to about their weight tell me how they started off slightly overweight, but the combination of both age and ingrained habits led to unmitigated weight gain that was near impossible to lose. So moral of the story is stay within a normal weight range, and if you end up going down the dark side, please do everything you can to return to a normal body weight. My girlfriend has ... Well, we don't know what she has. We thought she had fibromyalgia for years, but she recently tested positive for Lyme disease and she's almost certainly had it for over 7 years. But she might still have fibro or some other illness, we don't know yet. So she is very fatigued and weak and has severe balance issues and trouble walking and tires very easily to the point she then has to nap for a while to be able to do anything but watch TV, which is still her main activity, even though she's more of a computer person. But anyway, her goddamn mother came over for her birthday, and my girlfriend wanted a cough drop for the minty bit since her acid reflux was acting up, but the drops were all the way in the bedroom. I get up to fetch them and her mother is all no. She should go get them. No, your daughter is disabled. Even if she'd be able to walk there and back, she'd then be so out of it she wouldn't be able to hold a conversation with you and you just got here. What mental health really needs is more funding. Los Angeles County has a fairly robust system to find and help people who are having psychiatric emergencies. Someone who is a danger to themselves or others, or so disabled they cannot take care of themselves, they are placed on a 5150, often within the day. This is accomplished by county psychiatric emergency teams, law enforcement officers, and doctors, all of whom are aware of the warning signs and trained to find them. Once 5150'd, though, patients get sent to county psych emergency rooms. The problem is, these facilities are terribly underfunded. Evaluations are quick and impersonal by necessity. The psycher at Harbor UCLA Medical Center is so busy, patients are relegated to bedrolls laid out on the floor of the hallway because there aren't enough rooms. The average wait time for an ambulance crew with a 5150 patient at Harbor is 2-3 hours, and I'm speaking from experience on that one. Once in the system, psych patients are diagnosed fairly quickly and placed on drugs which help with their varied afflictions. When in structured care environments, psych patients can improve greatly. But most psych patients don't have a lot of money and are being cared for with county money. Once that money runs out, it's back to the street, where they go off their meds and picked up again by a pet team member or Leo to get a few months of care again. Ebola is far too deadly to be any good at killing. It's not particularly infectious, kills the victim within a few days, and causes symptoms that are impossible to hide. The infected are bedridden almost immediately, giving them little chance to spread it to others, and it can generally only be caught through direct contact with the infected or their fluids. It will occasionally wipe out an entire third world village when it contaminates their food or water, but always burns itself out before it can spread far. C. difficile is a highly contagious form of epic diarrhea that can actually kill you, and is spread by the spores in it, which is why we nurses gown, gloves, goggles and mask when having to deal with it. I even strip to my drawers on my porch when I come home from work if I've been in a C. diff room since I don't want to give it to my kids on accident. I would rather deal with AIDS or of hepatitis than C. diff. The former two are easy to kill, but not C. diff. It's a little survivor. Alcohol does not kill it, and the spores can survive for up to 6 months on common, regularly touched surfaces. C. diff can only be killed effectively by bleach and handwashing. Why does hand washing kill it? Friction. Friction kills the spores. You don't even need chemicals to kill it, just wash your hands. So wash your hands and avoid pooping yourself to death one day. I volunteer in the at a local hospital. I don't do anything important, just stock cabinets and the like. I'm not a doctor or a med student, just a public health major and an infectious disease nerd. But for the love of God, why can't people just listen to doctors? They didn't just go through all those years of schooling for you to tell them what to prescribe for you. The immense amount of anger I see when doctors don't prescribe patients what they want is ridiculous, and the amount of disrespect of doctors and nurses is disgusting. And when people are told they have something viral that doesn't need an antibiotic, they're like, well, can't you give me one just in case? No, your viral infection isn't suddenly going to turn into a bacterial one. Patients often demand an antibiotic because they have symptoms that match a bacterial infection even after they are told they have a viral one. It's like they can't fathom the fact that viral and bacterial infections can have similar symptoms. I've seen frustrated doctors actually call for cultures for patients who say they have sinus infections. They don't normally do that. When the culture comes back and there's nothing there, the patient is astounded. It's like some people don't even believe viral infections can exist. I was stocking linens in a room once something like this happened. The patient was like, but I have sinus pressure and yellow mucus and a fever, so I must have an infection. The doctor said yes, but it was probably a viral sinus infection and that it would be disadvantageous to give antibiotics. The patient then got pretty angry and was like, but sinus infections are bacterial. I can understand this train of thought slightly. It was only a few years ago that a study came out saying it was found that sinus infection could be viral. But still, if a trained professional is telling you that you definitely don't have a bacterial infection, that an actual culture of your freaking mucus did not show a bacterial infection, you're not going to listen to the doctor. I wanted to bang my head against the wall. Honestly, I blame the media for this antibiotic obsession. These medical shows always show something being able to be prescribed for all the illnesses depicted. People just don't get that these are fictional renditions. You have a virus. They can't prescribe anything for you. You don't need an antiviral. You don't have HIV. Go take some echinacea and go home and rest. I'm saying this out of my own experience. I'm not a nurse or doctor, but pilonidal cysts. I had one right above my tailbone. I had my mother look at it and she assumed it was a pimple. So, I popped it myself. But she never took me to the doctor's office. So it festered for 7 months. It wasn't until one night when I pulled about 5 giant chunks of 4+ inches of hair out of the opening that she decided to take me to the doctor. Most people just made fun of me for it. It's honestly something I'd never wish upon anyone else in this world. Hey, I'm an RN at a level 1 burn ICU. We do other severe dermatological conditions as well. The aforementioned diabetes, antibiotic resistance, and sedentary lifestyle are really the best answers. But aside from those, in my experience, there are 2 things that scare me. 1. Stevens-Johnson syndrome. This is more or less a hyperimmune allergic response that literally causes most and much of your skin and mucous membranes to slough off. You become soup in a hospital bed, your outsides and insides basically liquefy. You die a torturous death. 2. Flesh-eating pathogenesis or necrotizing fasciitis. This is more common than people think. It's not necessarily some obscure jungle disease. Usually it's a snowball effect between your immune response, medical treatment, and the pathogen that results in the exponentially rapid anoxic death of tissue. Bacteria eat the dead tissue, reproduce faster, kill and eat more, etc. That's the cycle. Immediate amputation, or other radical wound excision is the only option compatible with life. Everyone has heard of malaria. Not as many people have heard about dengue, malaria's evil twin. It's called breakbone fever. One of the older treatment guides I read advised that soldiers suffering from dengue be separated from their weapons to prevent suicide attempts. It's also coming to the US. Chikungunya is a little concerning, but doesn't scare me as much. To top it off, dengue has a hemorrhagic syndrome. Dengue hemorrhagic fever. It looks very similar to other hemorrhagic fevers, like Ebola. You walk into a patient's room to examine them, and see them bleeding and know that they have a fever. It was one of my nightmares right up until I walked into a room this way. Haven't had that nightmare since. Silver bat rabies. We've seen over a dozen cases of this variant of rabies where the victims don't have a scratch on them. Think about that, rabies that doesn't require a bite or a scratch. How many of you walk under trees with a moderate canopy? How about the eaves of roofs? Or houses that have gutters? Do you have a fireplace? Any holes in your basement? Bats are like mice with wings. They can get into the smallest space and will shed their wastes on whatever walks below. In fact, frequently, bats will expel their wastes if they're at all disturbed. Silver bat rabies. Fascinating. Sin-Nombre or the Four Corners virus. This is scary stuff. This virus struck several people, seemingly at random, in the Four Corners region of the US. The name was changed after people in the area complained. Viruses are frequently named for the location where they are found. Ebola is classified in various substrains: Ebola Zaire, Ebola Sudan, and Ebola Ristan. Sin-Nombre is one of the types of hantavirus. Hantavirus typically causes either a hemorrhagic fever or a pulmonary syndrome. This disease most commonly comes from aerosolized mouse urine. Think about that, you sweep out your garage, and the next thing you know either your lungs are filling with fluid or you're bleeding from every orifice, and your kidneys are failing. Mice, found in the heartland of the US. Mice sleep well. I had a tooth abscess last year. I thought it was just a sinus infection, so I didn't do anything about it for a while. Then one day, my face and neck swelled up to look like I had a goiter. I went to the doctor, she said it was nothing. It continued swelling to the point that I couldn't breathe or swallow. I went to the ER, they did a CT scan, couldn't tell what was going on. Gave me IV antibiotics and pain medicine. After none of the doctors could help me, I decided to see a dentist.
Turns out it was a severe abscess.
Dentist told me it was the worst he had seen in his career. Moral of the story, if your tooth is bad, just get it looked at. You don't want to lose your teeth or get an abscess. They are miserable and expensive. Not exactly a very common occurrence, but one that has always scared me is necrotizing fasciitis. Once had a 40-year-old female who came in with leg pain. Over the course of 3 days she had to undergo a few debridement surgeries, 1 amputation, and still passed away on the 3rd day. What happens is that you develop an infection in the tissues underneath the skin, which spreads really fast even with full antibiotic coverage, and the skin above starts dying off due to the impaired vascularization. Focuses as to why this happens are usually very trivial, like an unsterile liposuction, or even an unchanged tampon. That patient had none of those though, and the cause remained unknown. Some even speculated it may have been due to microcuts caused by shaving her legs. Not a disease purse, but self-medicating is one of my biggest challenges, which I do not think people take seriously. I would say at least 1 out of 3 of my consults self-medicates, and when lectured about the dangers, maybe only 1 out of 10 listen. One of the biggest issues is antibiotics. When they come down with fevers, they seemingly pick random antibiotics, with random doses and durations. 2 days worth, 3 days worth, 5 days worth, once a day, 3 times a day, it seems random. More often than not when they consult they have multi-drug resistant infections and usually a battered kidney, or liver to boot, having done it for years. One man had taken amoxicillin for headaches, swearing it works. On the other hand of the spectrum, you also have people who self-medicate maintenance drugs, which stops them from seeking consultation for months or years at a time, feeling they are doing all right. One patient took random oral anti-hypoglycemics only when feeling squeamish for her diabetes. She would inject herself with insulin when she felt she was still squeamish after the drugs. Another man only took antihypertensives when his home-bought BP cuff would register a high number. Once took 4 drugs and only went to the ER when the BP remained elevated and he developed a headache. Snapped at me when I said that wasn't how antihypertensives worked. Paraphrasing his reply, am I supposed to ignore high BP? Over-the-counter drugs are fine, but all ads do say consult a doctor if symptoms persist. Sadly, where I work, prescription drugs are doled out regularly over the counter. Deep venous thrombosis, which often leads to pulmonary embolism. All Archer jokes aside, people don't often consider them nearly as scary as they should be. Trust me, I work with post-surgical patients all day and they often just glaze over and stop listening when told that they need to take aspirin twice a day for about 4 weeks post-opus. DVTs and PEs are one of those things that are so much easier to prevent than they are to fix. By the time your entire leg looks like an eggplant, or you feel like there's an elephant sitting on your chest, you've often just bought yourself a one-way ticket to the ICU, if you don't die first. Not a doctor or nurse, but this scares me a lot. I had a friend who I thought died from this, until the autopsy found it was a weird genetic heart condition, Tara. Concussion, someone who has fallen and hit their head will feel dizzy, will slur their words, act irrationally, and most dangerously, will feel sleepy. All of these symptoms are how drunk people act. Drunk people are also a lot more likely to fall or fight and give themselves a concussion. So the combination of being drunk and having a concussion is almost impossible to notice. Next time you pick someone up off the floor on a night out, don't just assume they were already drunk. And that's why they can't speak. You could save them from dying from shock and hypothermia in whichever ally or bush looks comfy at the time. Personally, I am terrified of the thought of a smallpox outbreak, either intentional or natural. This is a disease that can have up to a 75% mortality rate, and for which we have no natural immunity. Up until it was eradicated from nature, it infected about 15 million people and killed 2 million every year. And we don't have enough vaccines to inoculate any significant number of people. If a single infected person were to walk into JFK Airport, touching doors, using the bathroom, mingling with the people in the terminal, etc., and then board a plane to, say, London, there would be a pandemic that the world's health community is completely unprepared for. By the time anyone realized it was smallpox and shut down air travel and whatever else it would take to contain it, it would be too late. Oh, and if you are lucky enough to be able to fight off the virus because it isn't one of the deadly weaponized forms, you still have a 30% chance of going blind as well as other complications. But no one seems to lose any sleep over this. I know I don't, because I am just as complacent as anyone else. But in the world we live in, people should consider getting vaccinated for it, if for no other reason than it would make it useless as a bioweapon. I don't even think you can get smallpox vaccine without going through government channels. I've never seen it listed anywhere for purchase. Some nosocomial acinetobacter infections are currently, as in today, resistant to every single antibiotic in the fricking world. Linezolid. Yeah, whatever. Cefepime. More like Cephedrine. ID docs lose their crap and don't really know what to do. The only thing proven is multi-drug antibiotic therapy. They try to flood the bacteria with so many drugs so fast it cannot compensate. It only works some of the time. And let's not begin on the side effect profile of a 5 broad-spectrum drug regimen. The only saving grace is that this infection resides in immunocompromised, bedridden, long-term diabetics. But now cases are coming up of healthy people getting it. It's like watching the evolution of MRSA all over again.